Good morning, myself Zulfa Ansari, and my topic is stomach. So, stomach is a muscular digestive organ which helps in the digestion of food by temporarily storing the food, mixing it, and breaking it down. It is located in the abdominal cavity between esophagus and small intestine. It has two ends, cardiac end and pyloric end, two surfaces which are anterior and posterior surface, and two curvatures which are greater curvature and lesser curvature. Stomach is divided into four parts: cardiac part or cardia, fundus, body, and pyloric part. Pyloric part has further three parts, which are pyloric antrum, that is 7.5 centimeter long, pyloric canal, which is 2.5 centimeter long, and pylorus. Now let's talk about some of the relations of stomach. Firstly, peritoneal relation, which includes greater omentum, lesser omentum, gastrosplenic ligament, and gastrophrenic ligament. Then comes the visceral relation, which includes anterior relation and posterior relations. So firstly, let's talk about the anterior relation. So it includes left lobe of liver, diaphragm, and anterior abdominal wall. Then comes the posterior relation, which includes the left crus of diaphragm, spleen, splenic artery, left kidney, left suprarenal gland, and transverse mesocolon, and finally pancreas. Now let's see the arterial supply of stomach. So the blood, the stomach receives blood from the branches of celiac trunk. Firstly, left gastric artery and right gastric artery. It supplies the lesser curvature of stomach. Then left gastroepiploic artery and right gastroepiploic artery supplies the greater curvature of stomach. Lastly, short gastric artery supplies the fundus of stomach. Now let's talk about the venous drainage. So the veins of stomach drains into the portal venous system. Firstly, left gastric vein and right gastric vein drains into the portal vein. Then left gastroepiploic vein and short gastric vein drains into the splenic vein. Then lastly, right gastroepiploic vein drains into the superior mesenteric vein. Lastly, we are talking about the lymphatic drainage. So the lymph nodes of stomach travels or drains along the lymph nodes along the arteries and finally reaches the celiac lymph node. So left gastric lymph node drains the upper part and lesser curvature of stomach. Then right gastric lymph node drains the lower lesser curvature, and then right gastroepiploic lymph node drains the lower greater curvature. Then pancreatic lymph node drains the upper part, fundus, upper part, that is fundus, and upper greater curvature. And finally, the pyloric lymph node, which drains the pylorus part of stomach. That's all about the stomach. Thank you.